Hello, everybody. Good afternoon. And I'm Dr. Tendril. I'm a psychiatrist working with Aster. I work in two clinics over here, one in Dera Mutina and the other one in Kisais. At the outset, I would like to thank the organizers for making an interactive session possible with all of you. And I'm looking forward to interact a lot with all of you. So we have planned the session such that like the first part would be like just an introduction to what mental health is and what are the common things which can affect your mental health and how do we go about all those things. And later, I think you can save all your questions for the second part of the session. That would be question answer sessions. So you can ask your doubts, whatever queries you have. I'm here to clarify things. Okay. So I think we can proceed with the session. Okay. So first, as the slide reads, mind matters. And it's not just matters, it matters a lot. So before going into mental health, I would just like to introduce the concept of health to all of you. So the WHO, the World Health Organization, defines health as a state of complete physical, mental, and social well-being. It is not just mere the absence of any disease. So it is not just because you do not have an illness, it means like you're well. Still, you need to be in a complete state, in a state of complete physical, mental, and social well-being. Scientifically speaking, mind is also in the body. So generally, that this separation, this dichotomy, like physical and mental, is not that necessary. But still, why this distinction happens is because mental health is given so much importance when compared to the rest of the other parts of the body. So that's why mental health is being assigned a special status and it has been mentioned separately. So otherwise, I could put it in another way that there is no health without mental health. So with this in mind, we would be just going to what in general health, illness, wellness, all such things exactly denote. What do they mean? So when it comes to health, okay, so physical health, mental health, all health put together. So somebody who has attained 100% health. So this 100% health is an utopian concept. Nobody can ever attain or be physically, mentally, socially 100% healthy all the times. So it is like it's a continuum. Like sometimes you could be healthy, sometimes you could be unhealthy, sometimes you could be ill, sometimes you could be sick. So you just keep fluctuating between illness and wellness. But our focus is to keep you well most of the times. That is what we are trying to focus. So here we need to get into two concepts. As the WHO definition, the absence of illness doesn't mean like you are always healthy. Okay, so there are two things. In other words, sometimes even when you have an illness, if you have identified the illness correctly at the correct time and you are getting proper treatment under, you get special care for the illness, despite your illness with your routine lifestyles and your the healthcare management, you could still be healthy. So that is what is a concept like. So that is why you can see in the slide two axes. So one is about the mental health, the vertical one, and the horizontal one is about mental illness. So even people with a mental illness, okay, so they can be having a high mental health. If you see it, high mental illness, but they have a high mental health. The mental health is good. That is because they've been identified at the right time, they are getting them treated properly, and obviously their coping up skills and their lifestyle has been good even before the illness came in, or even after the illness they got insight into all those things and they started developing a good attitude towards health. So that is why even when they are mentally ill, when they have a mental illness, still they can have a good mental health. Similarly, on the other hand, if you see, like sometimes patients, some of the persons, they need not have a diagnosed a mental illness, but still, if their coping up skills are bad, if their relationship skills and their communication skills are bad, if the interrelationships are not so great, then they can suffer from low mental health. So that is what the slide says. On the other hand, even without mental illness, you can be mentally unhealthy. So that is what we try to say. Like, so these two are related concepts. So again, just to emphasize the same thing, to reinforce the same thing. So even without mental illness, you can be mentally unhealthy, or even with mental illness, you can function with an optimum mental health. So now presenting the continuum model. So as we see, from red to green would be like healthy. So when it comes to mental health, when a person is healthy, what are the things we expect? So when do you say a person to be mentally healthy? So there are some affordabilities. Yeah, you can have normal fluctuations in mood. It is okay to be angry. It is okay to be frustrated or upset or to be happy. So there's normal fluctuations in mood, which according to the situations, according to your environment, there could be fluctuations in mood. That is healthy. And taking things in a stride, having a good sense of humor, and very consistent in your performance, having a normal sleep pattern, a healthy lifestyle, physically, socially active, and you have your own ethics, your own moral values, and being confident in yourself, and with limited substance use like alcohol or tobacco or any other behavioral addictions like video gaming, gambling, all those things, to a certain extent, when it is under control, we call them as healthy. They are mentally healthy. That is how we name them. So the next group is the reacting group. So the reacting group is like, for example, you have work stress, or there could be an ongoing stressor, workplace or at home. So at that time, you start reacting to things happening around you. So here, sometimes people could be irritable, they could be sad, or sometimes they have a feeling of being overwhelmed. And so this we call it as a reactive mood disturbance. Okay. And here this can be displayed in various forms. Like sometimes you tend to postpone things, you just procrastinate, or you forget things. You instead of humor, you start developing sarcasm and you pass sarcastic comments. And sometimes this might affect your sleep, your appetite, your energy level. Sometimes even you could have some disturbing dreams, nightmares, and you start taking some substances in order to cope up with all those things. We call them as reacting. We call them as reacting. Okay. So this is what is called as a reactive thing. Okay. So next is something we are moving from the wellness to the illness right now. So in illness, you have two categories. Like one, we call this that in the orange zone, we call them as the injured, and then comes the ill. Okay. So when you have ongoing stressors, or when there has been a very high genetic loading with family history of mental illness, in that case, you can develop frank symptoms and signs of a mental illness. In that case, we call it as either injured or sometimes being severely ill also. So what could be the symptoms, or what could be the things with which we identify whether the person is mentally ill? So the signs would be like, see, the symptoms of reacting and that of injured and ill are almost similar. But the thing is like the disturbance it causes in your daily activities, the persistence of these difficulties, and the intensity and the severity of these difficulties only make them as a mental illness. For example, you have an uncontrolled anger, pervasive sadness, it is persistent always, and you feel very helpless, hopeless, worthless, not able to concentrate on a regular basis, so that starts affecting your performance. You're not able to perform your duties, and there has been sleep disturbance throughout, and you experience fatigue, not able to concentrate, and sometimes you start increasing the use of alcohol or other things which will help you, which you think like would help you to get out of all those things. So these things make sometimes, if this all takes a hit on your mental health, and you could be mentally ill at that point of time. So you could see this mental health continuum where you move from green to red. So a healthy person, depending upon the situations, he can be reactive. So once the situation settles, or you develop your own coping strategies to deal with the situation, sometimes you go back to healthy, but sometimes otherwise you can be having, or you will be developing symptoms of mental illness. Okay. So this is what is the mental health continuum model, where you can keep fluctuating between all these things. So now in this slide, when you are in the safe zone, when you're healthy and reacting, there's nothing much to do about it. Okay. Self-help. So whenever you're reacting, self-help should suffice. So you should be able to get the things sorted out on your own, or sometimes with help from your friends or your family, a supportive family, or a good social support would suffice. But when you are injured and ill, okay, so when you start having some symptoms of a mental illness, in that case, you need a professional help. And the professional help, by that we mean that you need to consult either a psychologist or a psychiatrist. Okay. So this is why I think this will also would be one of the common questions in your Q&A, like psychiatrist and psychologist. So whom to consult? Okay, basically, who are they? What is the basic difference between a psychiatrist and a psychologist? So coming to this, both of them are mental health experts. So whenever you have some mental health issues, obviously you can approach either the psychiatrist or the psychologist. So depending upon the condition, if it is within their purview and they would be able to treat you, then they would be continuing, or else they would be referring to the other person. Okay. So now coming to psychiatrist. So psychiatrist is basically a medical doctor. So who graduates in medicine in MBBS, who graduates medicine and then undergoes extensive training, a postgraduate program in psychiatric medicine. So here iatry means treatment, and they treat the mental illness in the medical perspective, not of course ignoring the psychosocial perspectives. Okay, so here they conduct and prescribe medical treatments. And as I said, like it is not like psychiatrists don't give psychotherapy. Psychiatrists do give psychotherapy. When it comes to psychologists are people who have an advanced degree in psychology. So in psychology, there are many subspecialties and there are a lot of specialities in psychology as well. So they do a basic uh, course in psychology, then they specialize in different fields. And they have an extensive training in clinical practice and research. And they also specialize in psychological testing. You might be aware, like sometimes they test, especially with children, they do psychometric assessment to test their IQ, to assess their functional capacities. So this would be done by the psychologist. Apart from this testing, they also offer psychological treatments, the talking therapies. So this is what is the basic difference between the psychiatrist and the psychologist. So when you are in the yellow to red zone, like when you think your near and dear ones, or you do have some mental health issues, mental health symptoms, then you need to get the help of either the psychologist or the psychiatrist. Okay. So when they said like the session is going to be like around 3 o'clock, I was really worried because the post lunch session is always challenging because people tend to doze off. And the challenge was like how to keep them awake. Then I just gave a thought like, why should I? Okay, so just to de-stress. So even if you're not, let me try to make it interesting so that you could all listen and you could be able to follow. But still, if you cannot help it, I don't mind. So let us be a win-win situation. At least like I was able to de-stress you for a while. So now, coming back to the topic, stress management. So this is what any corporate setup, anywhere we go, the topic which they suggest to please talk about stress management. Okay, that would be the universal topic which is given to us. Okay, so now what is stress? So actually the word stress is borrowed from the physics. Okay, so any external pressure, so anything from outside, any pressure on the body, we call it as stress. And the changes which happen in the body, we call it as strain. Actually, the stress which we refer to is a strain which we undergo, but it's a misnomer, like we just call it as stress. So whenever the situation is very challenging, very demanding situation, obviously, as we say, a stressful situation, it could be work pressure, or it could be some financial crisis, or it could be some domestic issues at home, or on the whole, the world has been shook by COVID. So anything, so any level, at the individual level or at the national level, or like this pandemic at any level. So we are all subjected to different pressures. And to cope up with the pressure, our body struggles a lot. And that is what we call it as a stress response. So generally, the stress response, when the stress is going to be a short-lived one, and you are able to overcome, you bounce back with resilience. And the mental resilience is nothing but the capacity to bounce back to your normalcy, combating stress. That is what we call it as the mental resilience. So when the stressful situation is of a shorter period, of course, your mental resilience is good. You would be able to bounce back. But sometimes when the stress is an ongoing one, which continues for a longer period of time, or even without stressful situations, you can develop something called as anxiety and depression. So that is what we call it as SAD. Are you stressed out? Are you anxious? Are you depressed? So when we ask, are you sad? We have all these things. We try to differentiate between these things, like is it a normal stress response or as a progress to anxiety and depression? This is what we look into. So now coming to an anxious response. So what do you mean by a stress response, an anxious response? So any threat. See, for example, I would give an example of a dog, a rabid dog chasing you, okay, or snarling at you. okay, at the sight of the dog. So it's a physical threat, okay, it's going to just have a good meal, okay, bite. So what happens is like your mind starts preparing your body to combat that situation. So what happens? Your heart beats faster, and you take deep breaths. This is because the muscles need more blood, they need more oxygen, so that they will be able to contract and you'll get into action. Of course, the muscles get contract. This is because you need to get into action. You either pick up the stone or hello. So you either pick up a stone or you just try to run away from the situation. So this is what generally happens. So this is what we call it as a stress response. At this time, there will be a lot of hormones, stress hormones and chemicals that are released in your body, in your mind. But this is a very short-lived response, and they do not, these released chemicals in the body and the mind do not cause any harmful effects on you. But I will tell you another scenario. For example, it's an exam for the students or an interview. So the same response happens. Okay, you feel restless, you start shivering, and you just keep pacing just before you enter the exam hall, and you use the washroom frequently. You want to pee, and sometimes you would feel like throwing up. So all these things do happen. But once you go to the exam hall and you settle down, you feel much better. You feel much better. So because once knowing the situation, once you get the question paper, you know what is being asked, whether you do know the answers or not, you start settling down because that uncertainty is over. Like you know what the questions are. So all these things, the difficulties which you had, the symptoms which you had, start settling down in a while. So this is a situation again where there is a threat. The threat is either the exam or the interview. But sometimes what happens, even without an obvious stressor, even without an obvious physical threat outside, sometimes you might have your mind would start preparing. The mind misreads certain things and it starts preparing your body as if it is a threatful situation. Only then it becomes difficult because it doesn't simply end. So in both these situations, the anxiety is going to be a very short-lived response because once the threat is thwarted, your anxiety will settle down. Here, just because there is no threat, it never settles down. So now coming to how is it relevant to us? Okay, why do we need to know about the stress response? That too, as he said in the post-lunch session, how important is it? That is because in the workplace, okay, the only word which we hear always is anyway, people say it is very stressful. The work situation is stressful. Everything is stressful, right from beginning the day and the end of the day, beginning of the year, end of the year, every time the only word which we hear is stress. So all of us are exposed to stress in our workplace. But how do each of us respond? Okay, there are four types of response which people can have. See, one is called as the flight response, where you tend to attack the threat. And the second is like flight response, you escape. So either you hit the dog or you run away. That is what is the fight or the flight response, which we generally discuss. And the other thing is called as a freeze response. So in freeze response, what happens is like sometimes you can see the animal playing dead when it is being attacked by a predator. Okay, because it doesn't know how to go about it, and at least it doesn't want to provoke the threat, the predator, and it starts freezing. Okay, the freezing means it is just inaction. And fawn response. Okay, fawn response happens like you tend to please the predator, you tend to please the threat. Okay, you tend to placate the threat. That is what is this. So in a workplace, how could this reflect? Okay, how do we show all these responses in a workplace? For example, when you're offended, okay, when you see like a threat coming, okay, it could be your boss, it could be your co-worker, or it could be sometimes your subordinate. So you see like he's going to be a difficult person, then sometimes you get into the fight mode. You get anger outburst, you demand perfection from others, and sometimes people have some demeaning way of speaking to others, sarcasm, criticism, trying to control others, and a feeling of entitlement, like I say it, being very dominative, and bullying. So all these things is because it doesn't mean like the person who is bullying, who behaves as if he's been entitled to do all those things, is quite happy and contented with that. He also has his own limitations. Okay, so he is also suffering from inside, but the thing is like it is shown, it is displayed outside as a fight response. Coming to flight response. So sometimes in the office, you will also notice some people who are overworking, overfunctioning, and overachieving. Okay, so these people generally, they tend to overwork and overachieve things because They just to try to run away from the threat. In response to that, one of the way of coping with all those things is like indulging in more work. So what all they could have? They could have feelings of anxiety and panic. They could be workaholic, always rushing around, and always tending to be perfect. Okay. And it is not like they tend to be perfect. Sometimes they also drive others crazy in the name of perfectionism. Okay. They would want everything to be done in their own way. It is like my way or the highway. That's what. Okay. So this is the flight response which you can have among your workers or among your, even in you. And next is a freeze response. So in freeze response, what happens sometimes? So when the threat is so intimidating, they just when the predator is so big and they are tiny animals, sometimes it just freezes. Okay, and you detach yourself from what is happening around. You become indecisive. Even for simple things, you can't take your decision. You tend to and there's total inaction. So there will be procrastination. There will be delaying. You don't work. You don't meet targets. You wouldn't be able to work in such an environment. You wouldn't be able to be productive in such an environment. That is called as the freeze response. And the fourth category is a fawn response, where people tend to please the threat. Okay, so they become people pleaser. And here what happens is like the more they bully, the more you try to please them. And the more you try to please them, they bully you more. Okay, so they expect more from you. So this is what is called as a codependent relationship. In knowing or unknowingly, you increase the abusive relationship. And though it becomes more abusive, you just want to stay in the violent relationship because that is what is it gives you a sense of security in this situation. Okay, so whenever a person has got a fawn response, he would be easily taken for a run. So he could be easily exploited by others. And there is sometimes the person ends flattering up others. And even they want to speak against, like, though they are not satisfied with what is happening to them, still they cannot speak up for themselves. So these are the different typical trauma responses. So if you can analyze yourself and also sometimes your co-workers or your boss or your subordinates, you can fit them into any of these categories. It's not like strictly you need to categorize and pigeonhole and put them into all these things. Certain times we have certain responses. For example, when I have the affordability where I can speak up, I will go for a fight response. So when I don't have the affordability, okay, I might lose the job. So he's a superior authority to whom I cannot do it. So I might either go into a flight response or a freeze response. So the same individual across different settings, they can have different stress responses. Okay, so this is what is a stress response. So now in stress response, so what do we do about it? Now we do know, like, what is the situation? Yes, it's a stressful situation. And I'm able to identify, like, these are the responses. Okay, sometimes I go into your fight mode. Sometimes I go into your flight mode. So, but what do we do? How do we go about it? It's a common question which all of us ask us. So now, like 4 Fs for stress response, you have 4 As of stress management. Okay, so the first A is avoid. What do you mean by avoid? So it is like avoid unnecessary stress. Learn to say no. So this is what we always say. Don't overwork, don't overdo. See, there's nothing to prove yourself at any point of time. Okay. So here, for example, see, you can do everything. It is not like I'm just undermining anybody's capabilities that you won't be able to do. So if you try and if you have the perseverance, of course, anybody can do anything, but you cannot do everything. So this is what is you need to know. So when you are not able to do something, it doesn't mean like you cannot. It simply means like you need not. That is what. So you should know what are the unnecessary things which you need to avoid and learn to say no. We always say it is okay to say no. So this is what, whenever somebody gives us an instruction or somebody a task, though we wouldn't be able to do that, we just accept it. And this is what is the reason for stress most of the times. It is okay, and you will have to say no to certain things and avoid people who stress you out if possible, and avoid situation that stresses you out. Okay, so this is what is avoidance. But not all situations, all peoples you can avoid. So in that case, alter. Okay, try to think differently and communicate differently. See, this happens. See, in a workplace, there is always interpersonal relationship, a lot of communication going on between people. So here what happens is like, if you find, see, we often say people, say, I have been telling you n number of times, you don't get it. Okay. it is not his problem, actually it is your problem. Okay, when the person doesn't get it, possibly you shouldn't be telling it in the same way. So in that case, you need to find out like in what ways can I communicate to that particular person to make him understand. Okay, so be willing to compromise and express your feelings instead of hiding. And so this is what you say. See, nobody, it is not like you need to suppress all of them. Okay, so if you have the affordability and if you think like it is justified, it is always you have the freedom, and you should utilize the freedom of expressing your feelings instead of hiding it. And the third A is adapt. Okay, this is a very important A, I would say, because the organisms which adapt survive. Okay, so and the thing is like it is one of the key for evolution also. So you evolve by adapting to the environment. So adjust your standards. Okay, sometimes if it is low, you need to set your bar high. If it is of very high standards, definitely you need to set your bar low and reframe your problems. So look at the bigger picture. Okay, so losing once, that's what we always say, like choose your battles wisely. Okay, you can lose battles at times once or twice, but you look at the bigger picture. It is okay when something you say is not being accepted, okay, at this moment, as of now, but things could change. Okay, and accept different ways to proceed. So be open-minded, be flexible in accepting things from others also, so that you will evolve as a better person. And the last is accept. Yes, there are many things which we can change, but there are certain things which cannot be changed. In that case, we need to accept them. So how do we accept them? We need to accept them gracefully, and do not try to control the uncontrollable, and focus on the positive. And we will have to always strike a balance between anything. So it could be like work life or pleasant, unpleasant, healthy, unhealthy. So all these things you need to strike a balance. So this is what the 4 A's of stress management are. One is avoid, alter, adapt, and accept. So now coming back to this. So when you're able to do all those things, the 4 A's of stress management, once you understand that and once you start implementing that, okay, see, this is nothing exotic out of world thing which I've told you. This is the same generic advice which anybody would give you. So it could be your co-worker, it could be the social media, people in the social media, or it could be your spouse, it could be your parents, all would be saying the same. We just categorize it, we word it, we phrase it in such a fancy ways. But the thing is like all these things are already known to you. So these are all self-help things which are widely known to all of us. So these are things of common sense, but they aren't things of common practice. That is what we need to we need to put them into practice. So when your stress response is healthy or reacting, these self-help things do work. But if your stress response has been something like injured and ill, you might need professional care. You have to go to a mental health expert. So now coming to what are the common mental illness which can be caused by stress. So the common mental illness would be like anxiety and depression, as we already discussed. So what is depression? Because depression is a term which we hear day in and day out. It's been commonly used right now. And people say like there's a lot of awareness about depression because everybody knows what depression is. But basically, depression is different from the normal sadness. So sadness everybody experiences at one or the other point of time in life, which could be short-living, sometimes long-lasting. Sadness is universal, whereas depression is not universal. And in sadness, sadness might come and go. Whereas in clinical depression, it is a persistent feeling. You always feel, or most of the times you feel sad. You feel hopeless. That continues for a longer period of time, like weeks or months. And usually sadness would be brought by, there would be some specific reasons for you are sad. So whenever you're sad, people will, the first question they ask you is like, why are you sad? What happened? It would be the first question because there is usually a cause or always a cause. Whereas for depression, even without an external reason, an external cause, you could be depressed. Okay. So while depression can be linked to specific external triggers, so we just link to it, but that isn't the case always. Even without a stressor, you can develop depression. And sadness doesn't interfere much with your work, but depression does interfere a lot with your daily works. So how does depression look like? So depression can look like being, anybody can tell he's depressed because he's very sad, he feels very low, or sometimes people tend to isolate themselves from others, or when they struggle to maintain their appearance, disheveled and not so interested in dressing and things like that. When they find difficulty in completing their work, even starting their work, not able to do their daily tasks, or don't feel like getting up for work, lying in the bed, doing nothing at all. So this is what is a general thing people think as depression. But the other side of the coin would be like depression can also present like a person being very humorous, overcompensating with humor, making an effort to make others happy, pushing through works and chores, okay, overworking, doing fun things but not able to enjoy it, and repressing feelings. So that is basically they just try to hide all those things. They pretend and put up a good show like they are normal. Okay, so this is what sometimes we call it a smiling depression. So always depression need not be sad, tearful. It can also be a smiling depression. Okay, so now coming to the other things of depression, what are the common symptoms of depression? Easy fatigability. It is not like at the end of the day's work you feel fatigued. You feel easily tired. Even with the slightest of work, you feel tired and you don't feel like doing work. Or it could be like decreased interest and motivation to do daily things. See, when I say like be the energy level or the interest and motivation, it is not for any adventures, big tasks. It is for your daily, day-to-day activities. So it is not like you end up doing nothing, but things which you were doing effortlessly, even without giving a thought. Now you need to push yourself very hard to do such things. And your appetite could be disturbed. You might be eating less or eating more, binge eating, stress eating, a lot of junk foods, or your sleep also could be disturbed. So either it could be a decreased sleep or oversleeping, and can affect your focus. You forget things very easily. You're not able to concentrate in work. There are many lapses in your work, and you feel less confident. And sometimes this can be accompanied by negative feelings like feeling hopeless, helpless, and worthless. And it's not uncommon to have suicidal ideas or ideas of self-harm and depression as well. So next, coming to anxiety. So in anxiety, as I said, like it is this chaotic anxiety. It feels and look like a tight chest, uncontrolled worries, overthinking, excessive worrying, being restless, having frequent headaches, panic attacks, shortness of breath, stomach cramps, loss of appetite, nausea, whatnot. So from head to toe, anxiety can affect any part of your body and it can show up anyways. So, but how do we identify? People with anxiety always say it feels like the mind is racing. I have so many thoughts at the same time, and it's hard to have one complete thought. And I'm not good enough. I'm blaming ourselves. Everything is happening all at once. It's so overwhelming, I cannot take it. And there is excessive worrying, a constant struggle, being out of control. And there is air, but I can't breathe, though air is all around. And I always think of the worst case scenario. I want to escape, but I'm not able to. Okay, so these are the common phrases, these are the common words which people with anxiety say and how they feel. So, in a nutshell, so this is what is depression and this is anxiety. In depression, you can have sadness, loss of interest, difficulty sleeping, difficulty eating, and in anxiety, you can have sweating, a sense of panic, um, raising heart, difficulty in breathing, feeling restless, nervous, or powerless. And anyway, there are some overlapping symptoms where you can have difficulty focusing, frustration, irritability, and going out of control. See, basically, all these things are like out of proportion, out of control. This could happen in both depression and anxiety. Okay. So this is what. So whenever you have depression and anxiety, when you have any of these difficulties, of course, you need to consult a mental health expert. So what if your near and dear ones have it? What to say and what not to say? This is very important. And always I emphasize more on this slide. This is because this is what is mental health stigma. See, it is not like always people tell you when you open up and talk to somebody, it will all be okay. It is not like people don't open up, they don't talk. They do seek help. They seek your help. So you would be the first one whom they ask for help. And they would be coming and telling up their problems. And sometimes we tend to tell them like, see, toughen up. See, you should be really mentally strong. You shouldn't suck up for all those things, okay? Just keep yourself strong, okay? That's what the common comment we say. The next thing is, you say life is not always fair, Baba. Nobody said life would be easy. You will have to go all these things. Then only you become a man, you become a woman, and all those stuffs. And it is not like you chose this. So this is your fate and you will have to go. And we simply dismiss it of saying it is nothing, it is just laziness. I also had at some point of time. And don't be dramatic. So when crying spells and so what is there? Nothing is happening. Why do you need to be so emotional? Don't be so emotional. Don't be dramatic. That is what people tend to say. And sometimes the worst is like people tend to say like, see, They compare with others. See, that their situation is so difficult, but still they are coping up well. Others have it even way worse than you. Why can't you do this? So all these comments, sometimes they could be well intended also, but still what happens is like it just invalidates the person's struggle, and the persons who seek help, they feel even worse than they already do. So stop judging. People don't come to hear your judgments, and try to be compassionate, open up, talk with them. And if you think like it's not a normal stress response, please encourage them to go to a mental health specialist. And that's what. To sum up, mental health is not a destination. It is a process. It is about how you drive. Okay, that is more important than where you are going. Of course, when you're driving well and driving constant and good, your destination will also be as sweet and as beautiful as this picture. Thank you.
Thank you so much, Dr. Tendril. There are quite a good number of questions for you. I'll quickly read out the questions for you. So there are some questions which is not relevant to the topic, so I would ignore those. So this is a very there's a very personal question. The question is, one of my brother gets excited on new ideas, goals for a day or two. I found lazy on goals, less focused on things, doesn't have presence of mind, doesn't have self-respect, non-contributors towards self-improvement. How can I help him for this?
So can you just go through the first part of the question again?
Yeah, so the question is, one of my brother gets excited on new ideas, goals for a day. So the starting would be he would be excited for one day, but then it goes on, he becomes lazy, he's not focused, he do not have that contributing aspect of it. So
Okay.
Yeah.
Yeah, I get it. So if I'm right, like what he says is like sometimes he gets excited with a new idea, he's so ecstatic and he wants to venture, but still he doesn't persist with that and he dips down. Okay, there are periods like where he's excited, but more often he's more depressed and he's down and he's not contributing much. Though he has ideas, this has not been translating to work. The outcome is poor. That is what it is. Am I right?
Correct, doctor. So any plans he would just make, but it doesn't it doesn't get implemented. He cannot focus on that particular idea.
See, again, no, here we don't want to make a diagnosis and tell right now because a lot of things, because it's just snippets, like just two or three phrases or two or three bullet points is not going to, we will not be able to make a diagnosis, a correct diagnosis. Okay. But possibly what he says is like most often he's in a depressed state. And sometimes in a depressed state, people tend to experience the other pole, like being excited, being happy, and things like that. Where we call it as it could be a mixed episode in a bipolar disorder. Okay. See here, please don't take it granted, like the doctor told it is bipolar disorder. It is not so. Often when patients come to us, we need to work a lot. We need to assist them a lot. Okay, we need to take a detailed history from the patient, observation of the patient. All these things are also important. See, when you go to a mental health expert, we don't run any test as such to make a diagnosis, like a blood investigation or even a CT scan or an MRI of the brain. We don't run any investigations. The diagnosis is made, or the assessment of the condition is made purely by history. It is historical. So we conduct a very detailed examination. So we see the client, and also we get collaborative information, collateral information from the relatives. We assess and we do a lot of family history, like any family history of mental illness. There are a lot of things which we look into before making a diagnosis. We don't just jump and make a diagnosis, but still when we have a set of complaints, we proceed. We are open-minded, but still we proceed in a particular direction to rule out this, then to go to other things. Okay. Here again, the age of the patient, what is the episode? This is the first episode, whether he had been treated before. There are a lot of things to look into. So I don't think like this giving a few snippet points and asking for a specific diagnosis or how to go about it is not going to help us. So the answer to this question would be like the last slide. You need to consult an expert. So you can either go to a psychologist or a psychiatrist and get a proper assessment done. Is it okay? Hello?
Yes, doctor. So, doc, going on to the next question, which must be the maximum number of crowd would want to ask that question. How quickly can we escape from minor stress?
Again, can you go back? I mean, can you come
How
again?
quickly,
Mhm.
how quickly can we escape from
Mhm.
minor stress?
Okay. See, actually, the wordings are very important. So, how quickly can we escape from stress, minor stress? Okay. So, there are no quick fix methods. That is what I would say. See, because as I said, like, see, sometimes, no, the minor stress, how to anticipate them. Okay. See, sometimes stress is not always unexpected, something which hits you from the back without your knowledge. Sometimes we do, there are situations like when you have been in the same workplace for hours together, you know there's going to be an inspection. Okay. There's going to be a project. There's going to be some days where you need to submit, you have the deadlines coming. So in that case, you need to anticipate it. Anticipating and getting prepared for all the stress would actually make it more manageable. So this is one thing. But when you ask me like what would be a quick fix solution, there are no quick fix solutions for any of these things. Okay. So the time management, stress management, and communication skills, these are very important in any field in that case. And you need to do a lot of work in all those things for self improvement. So once you are at your best, once you are better than what you were, you will be able to handle things in a better way.
Yeah, so doc, what I understand is planning everything ahead would help much
Yes, yes.
than going through the stress.
Yeah,
Anticipating what is coming to us may help. And if
yeah.
we are going through the stress, it's important that we communicate. We communicate to our partner, we communicate to our friends, we communicate to a psychiatrist if required.
Yes, yes. So exactly as you said, like, see, not all stressful situations can be anticipated. But though you cannot anticipate the situation, you know what a stress response would be. Okay. So at least you should be able to identify at the earliest, like this is what is a stress response to the particular situation. And if self-help is working, then go ahead. If it is not helping, then of course you need to seek the help of others.
So, Doc, next question, it actually excites me as well, is about a question is related to contentment. Like in the present world where everyone is running after success, how can we balance between success versus satisfaction?
Yeah. So this is again a more, I would say, like it's a philosophical question, it's a spiritual question. It is a very logical question, I can say, any way I can put it. It's a quite interesting question. So here what happens is like, see, anything. So when we mean success, when we mean happiness, when we mean satisfaction, see, all those things are to a certain extent very personal and very relative terms. Okay. For example, success to me would be different from what success is to you. Happiness to me would be what happiness would be different from what happiness is to you. So they are sometimes the meaning of these words, no, are very personal and subjective, as well as it is a very relative term. It's a very relative term. So first, in order to achieve that, we need to define, we need to have our own definition of what success is, what satisfaction is. Generally, the basic tendency of any human being or any organism in that sense, like it is very difficult to feel contented. So it is not like after you get everything, you feel contented. There is a very good saying like, I become easily contented with the best. Okay, this is how we all get contented. When we have everything, we feel contented. I feel contented with the best, but not everybody gets the best at all times. So we will have to mindfully practice this contentment. Okay. See, you will have to start practicing saying enough. This is enough for me. Okay. See, sometimes people think like they would be complacent. Well, others, as you said, in the competitive world, well, others are very pushy and competitive. Is it okay to be complacent? Sometimes it is okay. That is what, no, it depends upon the situation. It depends upon your personal goal, what your definition of success is, what your definition of happiness is. So in a materialistic world, I would say like everybody should take a break, should take a stop, think about and say like, it is enough for me. Okay. So this doesn't come naturally. You will have to do it in a very conscious, a very mindful way. That is how you can achieve a balance between contentment and success.
Absolutely, Doc. So, Doc, next question is my stress, anxiety goes straight to my stomach, and my IBS condition worsens, increased pain, frequent trips to washroom. Can you please suggest how to reduce the impact of stress and anxiety?
Very good. So this is a very pertinent question. This is because, no, see, when we describe about anxiety itself, we always relate it to body parts. Okay, I could see my heart pounding. Okay, so it is mostly the complaints would be like descriptive. It is my heart pounding. It is my head bursting. It is my muscle aching. Okay, and similarly, we always say like the gut feeling. Okay, whenever you are scared or whenever something uh, weird or something scary is happening around you, you say like, I have a gut feeling that this is going to happen. Okay. So the mind and the gut are very related to each other. Actually, we call it as an axis. They are related to each other. So basically, the mind controls every part of the body. Okay. So the GI, the gastric symptoms which you can have in anxiety could start from your mouth. So you can experience some bitterness in your mouth when you're anxious. You can experience dryness in the mouth, in the throat. There could be some burning sensation both in the chest or also in the stomach. And you can have a churning sensation in the stomach, some vague uneasiness in the stomach. Some people do experiences abdominal cramps, crampy pain, and the bowel habits can be either way. Like you can have loose stools, you frequently use the washroom, or sometimes you can be constipated as well. And these can be fluctuating. So there can be alternating bowel habits also. So these are all very, very typical symptoms of anxiety. And as you rightly put, anxiety, the IBS, the important component of inflammatory bowel disease is anxiety. Okay. So when it comes to managing anxiety, there are two things. So one is the psychotherapy. We give the cognitive behavior therapy for anxiety, but when it is so intense, we always go for medications as well to control anxiety. So generally, when you come to a psychiatrist, how we start any treating depression or anxiety would be like when it is moderate to severe. Okay. And exactly that is when people come to us, because for mild symptoms, self-help and it subsides. So people don't come to us at that point of time. So when the symptoms of anxiety or depression are moderate, are very severe, only then they come to us. So when they come to us, initially we explain the condition very detailed, like what causes, how it happens, why it happens, and then we start them on medications. So once within 1 or 2 months of medications, once you start improving, stabilizing, doing well, then we go for the cognitive behavior therapy or the talking therapy. As the CBT becomes more effective, you would be able to do focus on the cognitive behavior therapy well when you are on medications. So this is how we would go. And for you, you also need to consult a psychiatrist so that you can have a detailed workup. And it is not only if I'm not wrong, many a times what happens, it's like we tend to miss a forest, okay, looking for a tree. So it is not only you will have this gastric symptoms alone, the stomach symptoms alone, there could be other symptoms which I discussed as well. So it could be affecting your sleep or your productivity, your energy level, your thoughts, anything it could affect. Okay. So basically it could be anything, but we just focus on only one tree and we tend to miss the forest. So it is better like you go with the expert, you go to a psychiatrist, and they would be able to pinpoint other things also, sort things out, and they would be able to formulate a management plan for you for sure.
Yes, Doc. Doc, next question is similar to the previous question. I get anxious and my heart rate and blood pressure goes up before getting my body checkup by a doctor. How do I stop this to happen?
Okay, okay. So as he rightly pointed out, no, so this anxiety, as he said, it can cause increase in your heart rate and increase in your blood pressure as well. See, as I said, like in any organ, as I told you, is controlled by the brain. So, okay, the signals, the impulses come from higher above. So, actually, when you have an increased BP or something simulating a heart attack, they tend to take ECG and things could be very fine. Your ECG would be fine, your chest X-ray would be fine, your blood parameters would turn normal. But still, you could have some difficulties like increased, you could feel your heart racing on and off, or sometimes difficulty in breathing. All these things do happen. This is what we call it as anxiety. We say like the problem is not in the heart or in the lungs, it is higher up. So it is higher above, and the mind is the issue. In mind, it is all the chemicals and the circuits that is what causes all those things. Especially as he said, like whenever they go and visit a doctor, these parameters might be increased because like your blood pressure or heart rate might get increased because you are anxious, like what are they going to tell about my health? So this we call it as like illness related anxiety or health related anxiety. And this particular thing, we call it in our terms called white coat hypertension. So once you go to the hospital, check your BP, especially the higher value. So you know, no, BP there will be two values like 120/80 or 130/90. Here the numerator, the higher value goes very high. That is what is very characteristic of anxiety. When it is essential hypertension or BP as such due to other conditions, it would be a proportionate increase in both these values. Only when the numerator is going to be higher, then this is called as increase in systolic blood pressure, which is very typical of anxiety. That too in a hospital setting, we call it as white coat hypertension. These are all symptoms of anxiety. Obviously, the answer for anxiety management is the same as for the GI complaints, the gastric complaints, so go to a psychiatrist, get an evaluation done, and whatever that is suited for you, whether it is psychotherapy or the medications or a combination of both these things, the doctor should be able to do justice to that. But still, whenever you have a panic attack or an anxiety attack, it is never going to be life threatening. Okay, it is never going to endanger your life. But I do understand like it can be very distressing when you experience all those things, sudden increase in BP, your heart pounding, and all those things. But let me tell you, like a panic attack will typically last for only 10 to 15 minutes. It will settle down on its own, even without any treatment. It is never life threatening, but still it is very distressing. So at that time, try doing some relaxation exercises like muscle contraction exercises. So you can just hold your fingers, you can make a fist, like hold it for some time, then try to relax it slowly. Okay. And sometimes taking deep breaths could be like difficult in that scenario. So try to take some to slow down your breaths. Okay. Take slow breaths, though you're not able to take deep breaths, and see whether it's settling down. So this is for the first state, like when it comes. Sometimes it becomes very difficult, like people tend to have a feeling of impending gloom, like something is going to happen, something awful might happen, I might die, I might collapse. So this is what we call it as a fear of impending doom, which also can happen. But let me tell you, it is never an endangering situation, though it is very distressing. So just because it doesn't involve the heart and it's not going to be dangerous, it doesn't mean it need not be treated. It has to be attended like any other physical condition. So you will have to visit a doctor.
So, Doc, next question. I'm not sure if it is a complete question. How can you determine if an illness is causing depression?
Okay, okay. See, as you said, no, so we will be, there are many ways. One is like we tend to take a historical view. Like we ask like how it all started, when it started. We try to understand the difficulties contextual, like how they happen. And another way of assessing would be like running through a questionnaire. Okay, like what are the difficulties you have, how much has been the severity and things like that. See, sometimes when you do go to visit a mental health clinic, sometimes even before you visit the psychiatrist, see them, so you would be given a screening questionnaire by the persons at the reception to go through that. Okay, so there would be a scores which would reflect like how stressed you are, how depressed you are, how anxious you are. But for us, when it comes to us, we would be of course asking the questions in the questionnaire in a very methodical way, in a very methodical way, so that we try to understand your difficulties in the context of your workplace or in the context of your family. We try to take a longitudinal history, like how things were before. This is how we do an assessment. So, and the major thing is like you might be having few symptoms, but how much is that causing impairment? How significant is the impairment in your daily functioning? How much it affects you is also a very important aspect which we tend to find out. We tend to ask you and we tend to explore that area as well. So you might be having symptoms, but how much it is affecting your daily activities, your performance, your quality of life, that is what matters to us. Okay. So generally we had like 24 questions to diagnose depression. Later, the questions were like 9 questions to screen depression. And later it became like 2 questions. Now it is one single question like, do you need help? That's all. Okay. So with this question, if you think like you need help, you definitely need. So it doesn't mean like when they reply in negation, I don't need help, that could be a smiling depression as well. Okay. So when you feel like your partner needs help, your spouse needs help, your coworker needs help, do explore, do encourage them to open up, be non-judgmental and try to be supportive. That's what.
Now, next question is, what is a preferred method to manage stress? Taking medicines or some exercises, can it manage stress?
Yes. So as I said, no, like stress is universal. Everybody undergo stress at various points of time. So when your stress response is like healthy or reactive, of course, all the self-help things will work. We always recommend self-help things like having a daily routine, encouraging physical activities, and being in a group, socializing, having hobbies, indulging in hobbies and other activities, doing charity, whatever you feel comfortable, whatever you like, whatever you have a passion for, you need to go with it. And having a routine and having a healthy lifestyle, eating a healthy diet, exercising, and all those things would suffice. They would be more than enough if your stress response is in the green and the yellow zone. Okay, like when you're going to have a healthy stress response or a reactive stress response, these things would be more than enough, that would suffice. But if it is going to be injured and ill, when you are going to be in the orange or the red zone, you will definitely need a mental health help apart from this self-help things also. But the thing is like the timing of the self-help things. When a patient comes to us during the first few sessions, we don't ask them. See, it is like whipping a tired horse. Okay, do this, do that. We don't bombard all those things. So we try to analyze them. We try to comfort them with psychological therapies and medicines. And once they start settling down, only during the second or the third sessions, we just push them one by one to do all these activities. Okay, so it is self-help things are always helpful, but sometimes they might not be a solution to fix an illness. So having a healthy lifestyle, adopting a healthy lifestyle, being physically, mentally, socially active, and keeping yourself happy are all good things. We never deny that. Okay, but that wouldn't suffice in all the cases.
Next question, what are the symptoms of clinical depression? That the sadness of feeling depressed is always abnormal and uncontrolled by the person. How does one identify or self-evaluate when we go to psychiatrist?
So this is a very good question. See, well, how does the sadness, normal sadness, okay, normal sadness differ from the sadness and depression? Okay, see, as I said, like there is a normal variation of mood, we call it. See, for example, you hear a not a good news. Okay, you hear a bad news, you start feeling sad. Okay, and sometimes that can affect your sleep. It can affect your appetite. You don't feel eating that day. You're not interested in food. You're not interested going out for a while. For example, so okay, you don't get a job. Okay, or you fail in your exams. Obviously, you would be sad and you would be crying. So sometimes you would feel like you feel very low in confidence and things like that. You don't feel like eating, you don't get your sleep, you find it very difficult to carry out things. So this is what is called as normal sadness. Why we call it as normal sadness? Because there is a stimulus. There is one reason for which you are sad, and generally you tend to mourn for all these losses. Just give me a second. Just give me a second. Hello. It's not a And it's not yet over. So just the session is going on. Okay. It's okay, but just ask it. Sorry. So so this sadness, we call it as normal because there is a stimulus and it is appropriate to the stimulus. If, for example, the results come out, so you have failed. But if you feel like you want to kill yourself because of this, then we don't call it as a normal sadness. Okay, feeling once, just having a fleeting thing, a thought is different. But when you start elaborating upon it and you want to act upon the suicidal thought, then it is not a normal sadness. Or sometimes you don't eat for days together. Okay, like you require hospitalization for that, it is not normal sadness. So when the sadness is appropriate to the stimulus in all terms, like in its intensity, in its severity, and its duration. For example, you get a news, there is always, even when there is a death, we have a period for mourning. Okay, you are expected to at least recover from it over a period of 2 weeks or 3 weeks. That is what is a maximum. See, culturally, even for mourning, no, we have different timeline. Okay, you're expected to bounce back immediately in some cultures. In some cultures, it would be like the common period would be like 1 month or something like that. Okay, so when your sadness is in response to a situation and it is very appropriate to that, then we call it as a normal sadness. Whereas in depression, as I said, like you could feel sad. See, in depression, people describe like most of the times they feel either sad or they feel unhappy or they feel frustrated or upset. And this is sometimes even without a reason outside. Okay. But let me say you, this is very difficult to differentiate because there will be always a reason for you around, like for you to feel sad. Okay. Even otherwise, sometimes your depressed mood itself can make the situation worse. See, for example, you're depressed, your partner doesn't understand that, like what you're undergoing, and you are non-response or response, and her response to that or his response to that will make the situation even more grim. Okay, so but here it is not like the situation caused the depressed mood, but the depressed mood had caused the situation. So it is really very difficult to say like this can happen without a stimulus also. Whereas in depression, the sadness would be like persistent, very severe, and it would be associated with other symptoms like low energy, lack of interest, sleep disturbances, appetite, disturbances in appetite. All these things would be accompanying. It would be more persistent. It will last longer. Okay, it will be more heavy and it will last longer. And sometimes even when people do not describe they feel sad or unhappy, they say like the happy things, okay, things happening around me are happy, but I'm not able to enjoy. This lack of ability to enjoy things as before is also one of the pointer towards a depressed mood or sadness. We call it as, technically we call it as, in medical terms, anhedonia. Like I'm not able to enjoy the hedonic pleasures, that we call it as anhedonia. This is also very characteristic of depression. So this is how sadness, this is what is the difference between the normal sadness and the sadness in depression. It is out of context, out of proportion.
Understood, Doc. Doc, we will pick the last question. There are quite a lot of questions. I don't think we can finish it. So we will pick the last question. I know you have appointments booked with the patient. Thank you everyone for joining the session. If you would like to consult Dr. M. Tendril, you may go to website at Astor Clinic. Doc, you sit in the Karama branch, correct?
No, I
Yes. So
sit in
Astor Clinic.
Mutina. No, sorry. I sit in Mutina and Kisais.
Okay,
Kisais
perfect.
and Mutina.
So if anyone would like to consult Dr. Tendril, you may visit Astor Clinic, Mutina, and Gisais. I will pick the last question from the list of questions, and we will wind up the session. Thanks everyone for joining the session. I have symptoms of illness with some exceptions like no alcohol, no suicidal tendency. Also, don't criticize anyone, but avoid people. Cannot even plan with my son. I get angry or unbearable. But I do not sleep till 4 a.m. at least. I don't have any work pressure. Everything is good at home as well as at work. Can you guide me? What can be done? I want to play with my son, speak with my wife, but I get angry for no reason.
Exactly. So this is what I have been telling right now. Okay, there will not be a reason outside. See, everything is perfect. Okay, I have a good job, I have a good family, happy children, good wife, and everything is fine. But still, something I'm not able to enjoy things. See, I want to enjoy, but still, I'm not able to enjoy. There's nothing I can find an excuse or a reason for. Everything is perfect. I have things in life, but still. So this is what is a medical condition, because this is what is exactly, see, his description, no, it typically fits into the things which I was telling, the sadness in depression. Okay, so apart from that, he did mention like he doesn't have few of the things in the checklist. See, the checklist is something like which we run through. It is not necessarily you need to satisfy all the things. Okay, if you have even if it's going to be a criteria for us, there would be a list of like 8 to 10 symptoms, of which there's always a cutoff, like 4 out of 8, 5 out of 10, something like that, or 6 out of 10. So it is not. So it is, as I said, no, this is just for the presentation. Just we try to put up all the things. Okay, for example, if a person has got COVID, he can have fever, he can have cough, he can have loss of smell, he can have tiredness. He can have difficulty in breathing. There are a lot of things, okay, of which the person can have 2 or 3, still it is COVID. The other person can have a set of other 3, still it is COVID. That is how it works. And to the person who has asked this question, though I'm not heard much from you, I think this itself is enough to say, like, of course, you come in the injured or the ill category. Like, these are obviously signs of concern. You will have to definitely look for a psychiatrist.
Yes, Doc. Thank you so much, Doc, for your time. It was a last minute request we had to make, and you supported us for this session. Thank you so much. It was a great help. Thanks everyone for joining this session. Hope it was a really informative session. Mental wellness is to some extent still a taboo. People do not go to seek help during the initial days of initial symptoms. So that is the reason we thought we will have this session to create the awareness on mental wellness. Even a small symptom of your constant feeling of sadness can be an initial symptom. Go ahead with your consultation with the psychiatrist. Make sure that it is not a diagnosis. It is just a instant symptom. Thank you so much. Have a nice day.
Yeah. And thank you very much. Like, I would also like to thank the organizers. Though, as you said, like, it's last minute, I always look forward to such opportunities to interact, because this is a platform which we get to increase awareness. So this is what is lacking. We need to talk more about mental health. And I would never like to miss out any opportunity to increase mental health awareness. And thanks for giving me such an opportunity. Thank you.